CNA Practice Test Virginia. Question 1. When a resident is on a bladder training program, the CNA should restrict the resident's fluid intake, take the resident to the bathroom on a scheduled basis, tell the resident to hold it as long as possible, always keep a catheter in place. Scheduled toileting helps the resident regain control and awareness of bladder function. Question 2. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes, every hour, every 2 hours, once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation. Question 3. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 4. A resident refuses a bath. What should the CNA do? Force the resident to bathe. Skip the bath and try again later. Tell the resident's family. Document that the resident is difficult. Residents have the right to refuse care. The CNA should respect the refusal and try again at a different time. Question 5. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 6. If a CNA sees another staff member hitting a resident, what is the first action to take? Call the police immediately. Stop the abuse and ensure the resident is safe. Report it at the end of the shift. Ignore it if it doesn't happen again. Safety is the priority. The CNA must intervene to stop the abuse immediately. Question 7. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 8. An ombudsman is someone who provides medical care to residents, advocates for the rights of residents in long-term care, manages the facility's budget, inspects the kitchen for safety. An ombudsman is an official advocate who helps resolve complaints and protect resident rights. Question 9. What is the first step in performing any procedure on a resident? Gather supplies. Identify the resident. Wash your hands. Explain the procedure. Hand hygiene is always the first step to prevent infection before touching a resident or equipment. Question 10. What is the primary goal of restorative care? To perform all tasks for the resident. To help the resident regain or maintain the highest level of function. To cure the resident's illness. To move the resident to a hospital. Restorative care focuses on helping residents maintain or regain their independence and physical function. Question 11. When should standard precautions be used? Only for residents with known infections. Only when the resident is coughing. For every resident at all times. Only when the nurse tells you to. Standard precautions are designed for use with all patients to reduce the risk of transmission of pathogens. Question 12. What is the normal range for an adult's oral temperature? 96.6 to 98.6 F, 97.6 to 99.6 F, 98.6 to 100.6 F, 95.0 to 97.0 F. The average oral temperature is 98.6 degrees Fahrenheit, with a normal range typically between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Question 13. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them. Question 14. A resident with Alzheimer's disease is wandering the halls. What should the CNA do? Lock the resident in their room. Tell the resident they are being naughty. Gently redirect the resident to a safe area or activity. Tie the resident to a chair. Redirection is a safe and effective technique for managing wandering behavior in dementia patients. Question 15. What is sundowning? Increased confusion and agitation in the evening hours. Sleeping all day and staying up all night. A skin condition caused by the sun. The resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 16. What is the most effective way to prevent the spread of infection? Wearing gloves at all times. Washing hands frequently. Using antibacterial spray on everything. Keeping all residents in their rooms. Hand washing is the single most important practice in preventing the spread of infection. Question 17. Which of the following is a sign of dehydration? Clear, pale yellow urine. Moist skin. Dark, concentrated urine. Increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 18. A resident's tray has a full glass of water, but the resident is on NPO status. What does this mean? Nothing by mouth. Next patient only. Needs physical observation. Nutrition per oral. NPO stands for nil per OS, meaning nothing by mouth. No food or water should be given. Question 19. When measuring a resident's blood pressure, the first sound heard is the diastolic pressure, pulse pressure, systolic pressure, mean pressure. The systolic pressure is the top number and represents the pressure when the heart contracts. Question 20. Which of the following should be reported to the nurse immediately during a bed bath? The resident is tired. A new red area on the resident's tailbone. The resident wants to wear a blue shirt. The resident is talkative. New skin breakdown or redness over a bony prominence is a sign of a potential pressure ulcer and must be reported immediately.